Ladies and gentlemen, dear colleagues and friends, today I will speak about system of protection from elder abuse in Republic of Serbia and speak about our experience. Uh, as we all know, elder abuse is a complex problem cross-cutting through public health, social sphere, and other distinct areas, and it is a violation of human rights. It if affects not just the older persons experiencing the abuse and her or his surroundings, but also the society, whole society. The phenomenon of demographic aging has over the past 20 years highlighted the problem of elder abuse, a problem that has for decades been quietly overlooked. Despite the attention that it has now, elder abuse demands additional efforts in at least three different directions. Further research into the phenomenon as a better understanding the scope of the problem as well as its different aspects, raising public awareness of the phenomenon as well as better prevention and better regulatory frameworks. And I will add, we need better coordination and cooperation of different stakeholders on national, regional, and global level. If we speak about Republic of Serbia, Serbian population has less than 7 million inhabitants, with 22.2% of the total population over 65. 57.5% of over 65 were female, as in the other country of all over the world. Older persons' share in the total population will continue to grow, especially women over 18. And we need to plan our systems of social welfare, health system, educational system, and all other system to adapt to demographic aging. And of course, we need to involve more older people in all our advocacy campaign and public awareness. When we start engaging with this problem about 15 years ago, there was only one available Serbian study on elder abuse. It isn't a national study, it was a small regional one. And then we realize that we need more research, because we need to know prevalence of this phenomenon in Serbia, and we need to explore regulatory and institutional framework in Serbia, existing policy and mechanism to prevent and respond to elder abuse, and effectiveness of the system in protecting the human rights of older people, because we all have equal rights regardless of age. Our Republic Institute of Social Welfare in 2016 collecting the data of reported cases of domestic violence and intimate partner violence, and out of number of 23,218 reported cases, 30% was reported cases of elder abuse. And in this data, you will see that similar number is in 2010. prevalence of elder abuse in Serbia established through research is higher and is in line with the data from other European countries as well as global data. We establish and we did 3 research studies about elder abuse and 2 studies that have focusing on older people in Serbia, and in 2019 we have then 2 studies about intergenerational solidarity, because we think that we need to change the picture of older people in all generations. First study, it was elder abuse, a study of violence in family context. It's a report providing the overview of existing legal framework in Serbia related to the protection from violence in family context. It also analyzed selected cases of elder abuse. And we have findings identify key problems in the management of elder abuse by institution in related to the provision of psychosocial support and legal protection to older people who experience abuse. And we saw how what is cooperation and coordination between public institutions and what needs to be done to improve this cooperation. The study analyzed the data on violence in the family context, providing from centers from social welfare and police administration from the second and third largest city in Serbia, Niš and Novi Sad, north and south of Serbia. Among the processing cases of family violence, approximately 10% targeting older family members. More than 75 of older persons experience violence in their families were female. The average age of older person who experienced violence was over 70 years. As for the perpetrators, the majority, more than 19%, were male, and most frequently was children and grandchildren of the victims. Physical violence was identified as the most common reason, whereas psychological violence was rarely formally reported. Probably because the tolerance threshold for psychological violence seems to be very high for older persons. Psychological violence needs a more precise definition so it can be better identified by the older person. Then we identify problems here, and we realized that in Serbia, in that research, no established and unfilled way and form through which to regularly and systematically record, document, and processing cases of violence against older persons. We realized that we have for same older persons different data in social welfare center and different data in police administration. We need one entering to the system. Then, no regular practice of exchange information between relevant public institutions. That's second problem. Third problem, not clear who should be responsible for the case management and what the procedure are. Who is safeguarding to older person? And then no specific services of social welfare for older persons, survivors of violence in family context. No safe houses, no SOS telephone, hotline telephone for older people who are victims of elder abuse. No free of charge legal advices. And that's something we realized that it's missing in Serbia. Recommendations were provided to improve the Serbian legal framework and as well as to the way cases of elder abuse were managed. It's suggesting that the criminal law of the Republic of Serbia especially recognize violence against an older person in family context as a distinct criminal act and aggravating factor. We send this recommendation to the government of Serbia. Second, our research was Introduction to Aging and Human Rights of Older People and pilot research study on financial abuse of older people. Part 1, the concept of human rights. Part 2, review of international, regional, and national legislative framework related to the protection of human rights of older people and anti-discrimination regulation. And part 3, it's exploratory study on financial abuse of older people and case study related to the deprivation of the legal capacity. Field research, it's interviews with 140 randomly chosen older person over 65 in 10 different municipalities in Serbia. And 69% of participation were female, and 69 lived in urban areas, 19 lived in rural areas, and 12 lived in peri-urban areas. What we find, almost 40% of the participants confirm someone else is authorized to use their bank account. 8% state that someone was using their money without their knowledge. Hypothesis arising from the result of the study is there is a market present of strong patriarchal in family relation characteristic by a model of parental self-sacrifice for their children. This increased the risk of financial abuse. And because of that, we ask our participants with one more question. And if they winning on the lottery, 50% of the participants said they would pass the hypothetical lottery winnings on to their children and their grandchildren. Only 9% would use this money for the traveling, or 7% would use to go to the spa or to rehabilitation. We send recommendation to the government of Serbia, and this recommendation was we need to improving the legal framework through amending the family law by addition of typical cases of financial abuse to the appropriate paragraph. A full deprivation of a person of their legal capacity is unacceptable unacceptable, and the legislation must protect persons' human rights. More in-depth research is necessary with a special focus on the different frauds, practices such as telephone marketing frauds. Public awareness on elder abuse and its prevalence need to be improved. Platforms must be provided for public advocacy activity, ranging from changing the legislative to changing against stereotypes, that are among major contribution to the different form of elder abuse. Third, research about elder abuse. The title is Well Kept Family Secret, Elder Abuse. The research was done through telephone, interviews with 800 person over 65. 90.8% of the 19.8% of the population over 65 in Serbia have been exposed to some form of abuse in their older age. 11% in the last 12 months. 11.5% of the population was exposed to some form of financial abuse, and 3.9% of older person reporting physical abuse. 7.8% reported psychological or verbal emotional abuse. And then sexual abuse is definitely a taboo. 50% of our interviewers declined to answer questions related to the sexual abuse. Only one interviewee reported that they were targeting of an attempt of sexual contact by a third party. The sexuality of older person itself is also kind of taboo, and it's rarely even talk about it. And neglect. 3.4% of older people reported neglect, and this percentage was higher, 5% for those who need assistance with daily activities. The data of elder abuse in Serbia is similar to data from global and regional in terms of overall prevalence and prevalence on different forms of elder abuse. And then we have two studies about aging, older people in the rural area and aging in the cities. And when we speak about age discrimination, in this research, we realized that in rural areas in Serbia, 27% of the participants reporting having personally experienced age-based discrimination, and 33% of urban participants reported age discrimination. In general population, the number is 13%. Older persons appear to be at a higher risk of discrimination than general population. And because of this, we need more public awareness, education, not only older people. We need to educate all population. We need to educate young people in the school, and we need to educate older person too. Awareness raising. We work in 3 levels: in local level, national level, and international level. In local level, a network of the Red Cross branches are a partnership with the local grassroots civil society organization and initiative, and we involve older people in all our activity. Every year we have education about elder abuse and about human rights of older people. Every year in every municipality we try to empowering older people about this topic. And workshop curriculum for older people on their human rights with a large section of elder abuse and protection form of elder abuse. This curriculum we use in Serbia. We shared with our partners in the region, Albania, Bosnia and Herzegovina, Macedonia and Montenegro. And in 2016, the Red Cross of Serbia supported to develop of civil society advocacy networks in Macedonia and Montenegro through EU-supported regional project. When we speak about national level, Red Cross of Serbia is founding member and coordinator of civil society organization advocacy network Humanas. Humanas advocacies for improved protection of human rights of older people, and one of its main focus is the issue of elder abuse. 18 members organizations in initiative of the network are aimed at policy marks to influence change in legislation so that elder abuse is defined as a distinct act of violence by law. International level, the Red Cross of Serbia is affiliate member of HelpAge International. We are represent international network of prevention of elder abuse in Serbia and in Europe, member of Global Alliance for the Rights of Older People, and Red Cross of Serbia participants in the process of development of the new United Nations Convention on the Rights of Older People. Advocacy experience from the global level are adapted for use in advocacy and national level and in a local level. We need to spread the word about elder abuse, about the human rights of older people. We need this that older people need to know what is happening in the global level. Red Cross of Serbia also works through the International Red Cross and Red Crescent movement, spearhead the idea that the movement should be more focused on protection the human rights of older people and to be a part of this global advocacy movement. When we speak about way forward, the Red Cross of Serbia plans for the future include work on several different levels. A plan to undertake a larger scale study using a representative sample on the prevention of elder abuse. A plan to do a prevalence study of elder abuse in residential care of older people in Serbia. We don't have any research in residential care. Other plans include established cooperation with organizations focusing on other social groups at risk of abuse, such as women, people with disability, ethnic and sexual minority. As a Romanian service provider of care for older persons, the Red Cross of Serbia also plans to focus on deeper cooperation with healthcare sector so that more attention is paid to elder abuse among health professionals. More work should be done on prevention of abuse through providing support to both formal and informal carers and establish support service for older persons who are survivors of elder abuse. And now we have more focus on financial abuse during the pandemic because older people in Serbia are in risk of financial abuse. We now prepare different education for older people, how to prevent the financial abuse and all forms of abuse during the COVID and how to prevent loneliness and social isolation. Thank you very much and see you next time in beautiful Prague.